Hi, I'm Dr. Marcus Lowe, and welcome to the Natural Health Show. Now, coming up today, how conventional medicine is embracing alternative therapies in the battle against cancer. Plus, the natural healing technique you can do literally standing on your head. Now, inversion therapy has been practiced for thousands of years in parts of India, but it's only fairly recently that Westerners have discovered the benefits for themselves. It's proved successful in treating complaints from stress and depression to arthritis and digestive disorders. So what is it? Well, to answer that question, I'm joined now by practitioner Paul Terrell and his partner Nikki Williams. Thanks for joining us.
Thank you for inviting us.
What is inversion therapy? I know nothing about it except what I've seen from you, and I'm impressed. So tell us, please.
Well, in this newer form, it's a technique that comes from an American acrobat called Benji Marantz, who invented a thing called acrobatic massage. And then it's been developed in Europe through the School of Inversion Therapy to its present form. It's a way, if you like, of doing the handstand without having to do it. It means that you can do this with people who have great difficulties with movement, with arthritis, brain-injured children or adults. It's very supported. It's a very safe way of getting all the benefits of inversion and treating a lot of disorders.
If you would go ahead and show us how it works, and I'm going to ask questions because it's rather dramatic to watch.
Okay. Normally it would go extremely slowly, and this would take 30 to 40 minutes. We're going to cut it down to 3 minutes, so you'll get a chance to see the kind of positions you might go through. Hands on my ankles, sit right down, drop your head back.
And the obvious to me, Paul, just to start off, does the person have to be in great shape to do this? It looks stressful.
Not at all. Well, obviously people choose to do this, having come to the realization that it would be good for their backs or their stress levels or whatever. Size, weight, and the amount of movement you can do is not important. In fact, you can keep the back remarkably straight in this position if it has to be kept straight. But for many people with, say, sciatic pain or back traumas, you see the back can be kept rather straight. So everybody can do this.
Yeah.
So the first position really is to do with gently stretching the spine and also building up the trust. And that's important at the beginning, and building the relaxation.
Well, let's go with that for a minute. The trust looks like a huge issue here, as well as when someone came to you. Would you have them do a position right away?
Not right away. We'd go into case history to begin with, and I might bend the knees, feet together. I might go into work with them on the ground first, just to check the condition they're in. You don't do this with people with glaucoma or detached retina or heart conditions associated with stroke. But apart from that, it's fine for everyone. And this position here it's one of the main positions, and as you can see, it's a position where the body doesn't have to hold on to any muscles at all, and you get all the benefits of inversion.
It opens up the spine.
Opens up the spine. It's a way of treating depression and neurosis because it increases the amount of oxygen to the brain. It also activates the pituitary gland and helps balance the endocrine system.
Paul, people should not do this at home?
Absolutely. People who want to train in this should take a professional training course.
Very good. How much does it cost, and where is it available?
Well, people should, the only school at the moment is the one that I run in Devon at the moment, and in America there's a school of acrossage in Hawaii.
And how much does it cost?
A treatment at the moment, a treatment or to learn
a treatment.
A treatment at the moment is £50 for an hour.
Very good.
So here, as you can see, it's more about the client getting in touch with their own relaxation, their inner healer, and going into a meditative state to become rather bodiless and to allow the emotional body to calm and balance, and also for the mind to slow down.
Is there another position that you move to?
Yes, let's move on now. So take the strap off the hands, and now let the legs come out to the side, let the arms go.
It's amazing to me, Paul, that you don't have to train for years, just as the patient, to do this. This looks physically demanding.
Well, it looks it, but in fact, the positions are really, I mean, this is a sitting position. This is where you are when you're sitting in a chair. So is the other position. It's just feet together as though you were sitting in a chair. So the positions, although they look extreme because of where you are, they're not.
So you can treat young, old, of any type of in athletic shape?
Yes. And I treat people who normally in a wheelchair, have difficulty with movement, walk with sticks. And it's also wonderful working with brain-injured people because you don't even need language, and it's a wonderful way of oxygenating the brain. And this last position here is very fetal, and there is that element of this of rebirthing, because you're hanging upside down, feeling
Just
supported,
like
nurtured, just like in the womb. So it takes you into that deep inner space where you feel without a body, without emotions, without mind.
Now, you look very strong and capable. Could a woman do this bottom position as well?
Oh yeah, there are many women training, and in fact women find it easier because they do it through softness, not strength.
Does Nikki do it?
She does it, and she's
She does?
extremely good. Put your hands on your ankles.
That's great. What kind of reaction do you get from people, particularly looking at how dramatic this looks?
I think in the first place, sometimes people think it's a bit of a circus trick.
Yeah.
But when they watch treatments, and particularly when they see people coming up after half an hour or 40 minutes of this, and they see how calm and relaxed they are, and also, of course, people come to it by hearing about the benefits people have got. So they can see it from the reactions people have and the calmness that it brings.
What is your reaction, Nikki?
Very much a feeling of being in a very quiet place within myself, and a feeling of trust and feeling very supported and nurtured, very safe.
Not really stressful to your body?
Not
It's really
at all.
comfortable? I'm
Relaxed.
very impressed. Thank you for joining us. Very, very impressive.
Thank you.
Right.